In this video, I'm going to discuss facelifts, starting with a brief overview. A facelift involves the latest technologies for facial rejuvenation surgery, lifting deeper facial tissues for a tightening effect. Older techniques are still used and can be endorsed, but non-surgical methods can replace them. When I mention facelifts, I mean deep facelifts involving the superficial musculo-aponeurotic system, SMAS. We lift deeper layers for tightening. Older techniques are still in use and can be endorsed, but non-surgical methods can replace them. Deep facelifts involve the SMAS layer, and we place superficial layers under tension. Now, who are the right candidates for a facelift? It's not a wrong approach. I endorse it in some cases. However, I want to stress their easy replacement by non-surgical methods. When discussing facelifts, I mean deep facelifts involving the SMAS layer. Surgery is done beneath that layer, placing superficial layers under tension. Who are ideal facelift candidates? What traits should they have? What facial changes might a facelift address? Some aging changes may not be facelift relevant or fixable. Let's discuss this. We perform the surgery beneath that layer, placing the superficial layers under tension. Regarding facelifts, who are the right candidates for a deep facelift? What changes are happening in their faces that might be addressed with a facelift? Recently, a 30-year-old wanted their facial tissues tightened. What characteristics should these individuals have? What facial changes might a facelift address? Some age-related changes might not be relevant to a facelift. I want to discuss this with you so you understand facelifts before considering surgery. Recently, a 30-year-old expressed a desire to have their facial tissues pulled tight and lifted. They wanted their face to look tighter and firmer. They insisted on a firmer feel, showing me with their hands how they wanted this area to feel. Understand facelifts fully before considering surgery. A 30-year-old recently expressed a desire to have their facial tissues tightened. They wanted a firmer look and showed me how they envisioned it. Despite no visible sagging needing correction, they insisted on a tighter, firmer face. Facial tissues are naturally mobile from childhood and aren't meant to be stiff. If you think a face should be immobile like a statue, that's a misconception. In cases without visible sagging needing surgery, they wanted their facial tissues tighter. Facial tissues are mobile since childhood and not meant to be stiff. Thinking the face should be statue-like is a misconception. Tissues firm in youth soften over time. Before sagging, they become softer and pliable. This doesn't mean surgery is needed. Facial tissues have been mobile since childhood and aren't meant to be completely stiff. If you think they should be statue-like, that's a misconception. Initially, firm in youth, tissues soften over time. Before sagging, they become more pliable. Surgery isn't necessary. Non-surgical methods can enhance tissue firmness, especially skin and underlying layers. Follow my guidelines. For those under 40, facelift surgery isn't recommended. Facial tissues have a firm consistency when we are younger, but they soften over time. However, their consistency becomes softer and more pliable. This doesn't mean you need surgery now. Instead, with alternatives, you can enhance firmness. Follow my guidelines. Under 40, avoid surgery. Use alternatives like thread lifts, fat injections, and skin techniques. Age changes affect tissues and skin. You can use methods for face rejuvenation, thread lifts, fat injections, and skin techniques. Aging changes aren't only sagging tissues. Skin and tissue volume change. Lipodystrophy means facial fat changes. This can mean volume increase or decrease. Tissues may lose volume. Fat can shrink or grow too much. Age-related changes aren't just about sagging tissues. We also have changes in the skin itself. We also have changes in tissue volume. There's a term we use called lipodystrophy, which refers to changes in facial fat. Sometimes this manifests as an increase in volume, and sometimes as a decrease. This means that the tissues can lose volume, and facial fat can diminish, or on the contrary, they can undergo hypertrophy and grow excessively. In any case, these changes occur with the sagging of facial tissues, but facelift surgery only corrects sagging. It doesn't fix tissue deterioration or wrinkles and signs of skin aging. A deep facelift tightens skin, making it look younger, but it only addresses sagging. For skin aging and tissue loss, consider complementary procedures like filler injections and fat injections. A deep facelift tightens the skin, but only addresses sagging. For other signs like skin aging and tissue deterioration, other procedures help. These include filler and fat injections for tissue loss and laser or fibroblast treatments to correct fine lines and aging changes. With a facelift, sagging is addressed. For the signs of skin aging and tissue deterioration, consider facelift complements, which include filler injections and fat injections for tissue loss, and methods like skin rejuvenation with laser treatments, fibroblast therapy, or other methods to correct those fine lines and changes caused by aging. Another facelift rule is you don't actually go back to being 20 years old. Rather, aging signs are reduced. This means you look younger than peers and your younger self. And procedures like laser skin rejuvenation, fibroblast therapy, or other skin rejuvenation methods to correct those wrinkles and changes caused by increased skin tone. Another rule regarding facelifts is that when we perform a facelift, you don't go back to being 20 years old. Rather, the signs of aging on your face are reduced. This means you will look younger compared to your peers and your younger self. Some people think that with surgery, we can bring you back to your youthful state, but that's not the case. We're just removing the signs of aging, and you'll appear younger than your actual age. A question that might come to your mind is whether, during a facelift, we can also address other issues that come with aging, like reducing facial volume with fat injections. Some people think that with surgery, we can really bring you back to your completely youthful state, but that's not true. We're just removing the signs of aging, and you'll look younger than your actual age. A key question that might be on your mind is whether, during a facelift, it's possible to simultaneously address other issues that come with aging, like reducing facial volume, for example, with fat injections, or to tackle signs of aging in the skin, like laser treatment after the facelift. Is this possible? I have to say yes, it is possible. I might not recommend it for everyone, but it can be beneficial for some people. However, they can do this with some time in between, meaning they can wait a while after the surgery to do this. So, if you want to undergo fat injections or facial laser treatment at the same time, it's not a bad idea. Or remove the signs of aging in the skin, like laser skin resurfacing after facelift surgery. Is this possible? We have to say that yes, it is possible. I may not recommend it for everyone, and some people may find it helpful. However, this can be done at a time interval, meaning sometime after surgery. So if you want to undergo liposuction or laser facial skin resurfacing at the same time, this is not a bad thing. I suggest delaying non-surgical procedures to speed up recovery. These procedures are more precise when done separately from a facelift. Swelling from facelift surgery can reduce blood flow, affecting fat injections. This may hinder the integration of injected fat, leading to poor results over time. Why focus on deep facelifts? Superficial facelifts offer shorter lasting results due to the swelling. From facelift surgery, blood flow to certain areas of the face decreases, and fat injections in those areas might face reduced blood supply. This means that the connection between the injected fat and the facial tissues might not establish properly, and over time, the fat could deteriorate, leading to results that look like you never had the fat injection done. Why am I talking about deep facelifts? Why am I not discussing superficial or less invasive facelift surgeries? It's because superficial facelifts have a shorter duration of results. Not everyone is suitable for this. It might be appropriate for specific individuals. Plus, there are non-surgical alternatives available that can save you from that surgical recovery period, and you won't have to deal with the complications of surgery either. It's not suitable for everyone. It might be appropriate for specific individuals. Plus, there are non-surgical alternatives available that can save you from that surgical recovery period, and you won't have to deal with the complications of surgery either. You can achieve all those changes that a minor facelift would bring by rejuvenating your skin and the layers beneath it. so you might not need a minor facelift at all. But when you can no longer achieve facial rejuvenation through non-surgical methods, you turn to surgical options to benefit from those techniques. This can complement well with good non-surgical methods, leading to better results for you overall. You do that facial hair removal? You can benefit from surgical facelift methods. Consider both a facelift and a forehead lift. A deep facelift rule by age doesn't apply to eyebrow and forehead lifts, as drooping eyebrows can be lifted even when younger. What's really important is that you consider a facelift, along with an eyebrow lift. Sagging can have genetic factors. A deep facelift doesn't apply to eyebrow and forehead lifts, as drooping eyebrows can be addressed with a lift even at a younger age. There won't be changes around the eyes and mouth with a facelift. Those areas won't change with a facelift. Even if it is seen in the 30s, it can be corrected at any age with a facelift surgery. So, if we had a rule that a facelift surgery is a deep facelift, after the age of 4, this would not include a brow lift or a forehead lift, because brows that have sagging can be corrected at a young age with a facelift. We can restore the eyebrows and improve facial beauty. A facelift won't change your face. Facelifts don't change eyes or mouth areas. Eyelid surgery, not included in facelifts, is needed for eye rejuvenation. Both surgeries can be done together for full face rejuvenation. The mouth area is similar. Facelifts may temporarily make the mouth look younger due to swelling. The mouth area returns to normal soon. If you want to rejuvenate the area around your eyes, you'll need eyelid surgery, which is not part of a facelift. However, you can have both the facelift and eyelid surgery done at the same time to rejuvenate the face. The mouth area is similar. The mouth area may look younger initially from swelling. The mouth area returns to its pre-surgery state. Remember, the mouth area and radial lines are not improved by a facelift. Again, it's the same thing. If you have a facelift, you might feel that the area around your mouth looks younger in the first few days, but this effect is short-lived due to tissue swelling. Eventually, the area around your mouth will return to its pre-surgery state, so keep in mind that the area around the mouth, like the radial lines, won't improve with a facelift and will completely require non-surgical methods. Also, for your eyelids, you need to consider eyelid surgery either before or after the facelift, or even at the same time, because the facelift won't change your eyelids. So, pay attention to the radial wrinkles around the mouth. Non-surgical methods are completely effective, and a facelift won't change your eyelids. You need to consider eyelid surgery either before, after, or even at the same time as the facelift, because a facelift won't affect your eyelids. People who come in for a facelift sometimes have the misconception that the recovery period after surgery is short and will be over easily. Some people come in asking if they can attend important meetings a week after surgery. My job is such that I can't take time off, and I have important meetings coming up. From our perspective, attending meetings a week after surgery is perfectly fine, but you should know that your face will still be swollen and bruised at that time, and it will look a bit unnatural. If this doesn't bother you during those meetings, you can go ahead and attend. However, if you have an important job, for example, if you're an actor who needs to perform a role in a film, or a TV host attending a significant meeting where you don't want others to know you've had surgery, you need to realistically estimate your recovery period. Keep in mind that the swelling will gradually go down and the bruising will fade within 2 to 3 weeks, but swelling takes longer to fully improve. You can schedule your sessions, but if you have an important job, for example, if you're an actor who is going to play a role in a film, or a TV host attending a significant meeting where you don't want others to know you've had surgery, you need to know that. You need to realistically estimate the recovery period. After surgery, knowing that the swelling will gradually go down, bruising will fade within 2 to 3 weeks, but swelling takes longer to fully improve. So, before your facelift surgery, realistically estimate your recovery time and plan your important tasks for after that period. What kind of people get better results from facelift surgery? People who take care of their skin. Those who pay attention to their appearance, have a well-groomed look, women who can apply makeup well, women who care about their beauty, and those who use moisturizers, anti-aging creams, and cosmetics are the ones who achieve better results. People who don't take good care of their skin, people who don't do anything to their face, don't wear makeup, don't pay attention to their facial beauty, don't even put a little bit of filler in their face, they don't do anything to improve their skin, in my opinion. These individuals are not suitable for facelift surgery and should consider non-surgical methods first. Simpler non-surgical options might meet their needs. Before deciding on facelift surgery, ensure it's right for you. A surgeon can make significant changes, but you might prefer subtle adjustments. If you prefer minor changes, non-surgical methods can address your needs. For significant changes, be aware of the necessary complementary care with facelift surgery, like Botox, skincare, sunscreen, and other post-surgery instructions. It might suit you, or it might not. A surgeon can make good changes to your face, but you might not like them and prefer subtle adjustments. For minor changes, non-surgical methods can meet your needs. For significant changes, accept the care that comes with facelift surgery, like Botox, skincare, sunscreen, and other instructions I'll provide. Remember, facelift surgery isn't yearly. It's done once, with effects lasting many years, so it's worth it. If you prefer significant changes, remember that facelift surgery requires complementary care. You might need Botox, follow a skincare routine, use sunscreen, and adhere to post-surgery instructions. My advice for facelift candidates is to remember that this surgery is not annual. It's a one-time procedure with long-lasting effects. Thoroughly research the surgical process, recovery, and suitability. Be fully informed before deciding on this surgery. In the end, my advice for someone who is a candidate for facelift surgery is to keep in mind that you're not going to have facelift surgery every year. It's meant to be done once, and the effects of this surgery will last for many years. So it's worth it. Before the surgery, make sure to research the surgical process, the recovery after surgery, and whether this surgery is suitable for you. Do your homework and be fully informed before becoming a candidate for this surgery. So, before the surgery, make sure to do your research about the surgical steps, the recovery process afterward, and whether this surgery is suitable for you. Be fully informed before becoming a candidate for this surgery.